Speaking to you about cataract surgery and IntraOcularLens, this is Dr. Rosemary, consultant ophthalmologist, Ahilya Eye Hospital, Pattambi. Now, the only reason today I sit here making this video is because last week I advised cataract surgery for my own aunt. She gave me a call in the evening telling me that I spoke to your counselor and the counselor ladies listed a long list of IOLs like an auction starting from 1 lakh downwards. I'm totally confused. You should tell me which IOL to place. That is when realization struck me that almost all my patients would be going home and telling the same tale. IntraOcularLens in cataract surgery, I agree, is not easy for a novice patient. We ourselves are constantly updating ourselves on all the new IOLs that are coming into the market, and now with artificial intelligence also coming in, newer research is going on in IOLs and we are updating the public on the newer IOL options available. Now, as I sit here talking about IOLs, I want to make one thing very clear at the outset. There is nothing yet like a perfect vision post-cataract surgery. The perfect range of vision with which we are born with, the God-given gift of perfect vision, is still a dream for the scientific world. But then, science and technology has indeed grown in leaps and bounds, and here in the next 5 minutes, I'll give you a brief account on what are the commercially available intraocular lens available in the market that you may use. Mainly, we have 4 types of intraocular lens. The first one will be the monofocal lens. Monofocal intraocular lens, once implanted in the eye post-cataract surgery, will help you to see for the distance. You can see a stage show, you can see a traffic signal, all your distance vision is going to be comfortable. You can see someone coming through the gate, but for intermediate and near vision, you will need glasses. You will need the presbyopic correction glasses for intermediate and near vision. The second category of lenses is the advanced monofocal lens. Advanced monofocal lens ensure clear distance vision and it gives you intermediate vision up to 6 to 6 centimeter. So your desktop viewing might be okay for you. If you want to chop vegetables in the kitchen, that might be okay for you. And if you're a person who can enlarge the font of your phone a bit, and if you hold the phone at an arm's length, you may be able to view your phone also comfortably, provided you put advanced monofocals both the eyes. Third category of lens is the EDOF lens. EDOF lens ensure clear vision for the distance, clear intermediate vision, and clear vision up to 40 centimeter. So the newspaper headlines might be okay for you at 40 centimeter and all activities till 40 centimeter will be okay for you. Now that phones have become such a huge integral part of our lives, EDOF lenses have come much into vogue in our cataract surgery practice. Now the fourth category of lenses are the multifocal lenses, the lenses that are advertised that you need no spectacles post-cataract surgery. You'll get clear vision for the distance, for intermediate and for near vision. Now mind you, this is a cataract surgery. We want to give you the best possible vision possible and the company also intends for the same. But then I again remind you, there is nothing like a perfect vision. You still might need glasses occasionally on some occasions. And one thing you have to take note is, these multifocal lenses have rings on them and it is by virtue of these rings that you are able to see for all distances accurately. The only drawback here is, if you're a person who has a night light, when you go outside, when you drive outdoors at night, when you look at point sources of light, you may see glaze or halos around those point sources of light and that might be a little bit disturbing for you. But if you're a person who doesn't have to go much at night, you don't have any night driving, but you want to be mostly spectacle independent, multifocal lenses might be a good option for you. So these are the main 4 category of lenses: monofocal, advanced monofocal, EDOF and multifocal lenses. Now, once you come to the hospital, you take your IOL measurements, you go home, you might receive a call from the hospital about whether you want to implant toric intraocular lens. Now, to understand what is toric intraocular lens, you need to understand the eye has a cornea in the front, there is a cataract lens in the middle and there is the retina behind. So whatever light comes into the eye has to pass through the cornea, pass through the intraocular lens that is placed and reach the retina, and that is how you see. In some people at least, the cornea curvature may not be perfect. So when the cornea has an abnormal curvature, it's called astigmatism. So when cornea has an abnormal astigmatism beyond a cutoff, what happens is the light that passes through the cornea is not very regular. So whatever IOL you are going to place, when you place a monofocal, advanced or any of those IOLs, the light passage through it is not going to be perfect. So the image that is going to be formed on the retina is also not going to be perfect. So what you can do is, in proportion to the astigmatism on the cornea, you can place a toric intraocular lens that will correct the corneal astigmatism and ensure a proper focusing of light on the retina. So in that context, whether you place a monofocal, advanced monofocal, EDOF or multifocal, those rays according to the type of IOL will be focused properly on the retina. Now, if you don't opt for toric IOL, you will have to wear an astigmatism correction spectacles post cataract surgery. That's all. So monofocal, advanced monofocal, EDOF lenses, you will need spectacles, toric or not, you will need spectacles for near normal reading vision at 30 centimeter. Now, one more thing you need to understand is, only in a normal healthy eye, regardless of the IOL placed, only if the eye is healthy, you will get good vision. That is, you need a clear cornea, you need a healthy retina. In that context, when you place an IOL, you will get good vision. So I hope this video on intraocular lens will help you for a hassle-free decision making in cataract surgery. Thank you.